we've had some really good attendance throughout the sessions we've been running with ABHI members over the past 18 months. This one's a little bit more focused, I think, in terms of attendance, but that's not a bad thing. Hopefully we can open it up to more of a dialogue at the end of the call and get to the root of things that you're interested in when it comes to preparing for the potential for crisis comms scenarios in health tech. It's a subject where I don't know if for those who don't know Highland Marketing, we're a health tech specialist marketing agency. We've been talking about and shouting about the value of health tech for close to 25 years now, and within that time, we've had the fortune of telling many really positive stories about the role that health tech can play in supporting effective healthcare delivery. But sadly, things do sometimes go wrong, and it's important to have the preparation in place to respond to that scenario when it does happen. So that's what we're going to talk you through today. I'm Matthew Darcy. I'm a senior communications consultant with Highland Marketing. I've been with the company now for a little over 11 years, and I've had the fortune to work with many healthcare technology companies during that time. John, I'll let you introduce yourself before we go any further.
Yes, thank you, Matthew, and thank you everyone for joining us this afternoon. Great pleasure to be able to share some thoughts on crisis comms with you. Very briefly, my background is I'm a classic poacher turned gamekeeper. Started life as a journalist, working in local papers, then internationals, doing my fair share of actually doorstepping celebrities, for instance, amongst other things. Been working at Highland Marketing for 4 years. I'm a senior account director. Had a fair bit of experience in crisis comms over the years, in previous roles, working in corporate communications field, where there was a long-running, I was part of a team that had to manage a long-running reputational issue, actually, that impacted the share price because of commercial issues, and eventually ended up with the CEO facing death threats. I had spent 4 years in an NHS comms role, and sadly, it's a mental health trust, and regularly we were dealing with crises relation to patient care. The highest point of that, unfortunately, was the death of a psychiatric patient due to a killing by 2 other patients. So quite a range of different experiences relevant to the discussion we're having today.
Thanks, John. And I think that's what we hope to bring to you today, our learnings from some of the scenarios where we've supported clients, or perhaps from other aspects of our experience, where we might be able to shed some light for you on how you might go about developing your own strategy, and should the worst happen, how do you respond to it? So that's, first of all, we're going to talk to you a little bit about, so what is a crisis, and why do you need to do that preparation work? We're going to touch on some examples. This is a very real issue in the healthcare space and for health tech, and some of the headlines in the media do sadly reflect that on a relatively regular basis. We're going to talk to you about, so if that happens, how can you prepare and manage a crisis? What are the key components that go into that? And we'll touch on a few alternative approaches that are out there as well. So many of the people in this room are health tech vendors, but I noticed there's some people from other environments as well, particularly within the NHS, and there are alternative strategies that you might want to be aware of as well, particularly if a crisis involves some of your partners. We'd like you to think about, really, throughout this, how prepared are you? Do you think you've got the right strategy in place already? Are you starting this from scratch? And if it's the latter, that there's help out there and support to guide you through that. That's something we support clients with on a regular basis, and we're happy to have those offline conversations, given the sensitive nature of this subject, if it is that's a preference for people on the call as well. But we'll then come to your questions, really, but it would be good to have that dialogue with you today as much as possible. But over to you, John, just to talk a little bit around the context for this.
Thank you. Yes, so we thought, just briefly at the outset, just to clarify in terms of crisis, what that is exactly. And we've got a couple of what we think are very useful quotations here. I think sometimes it's fair to say that, there are a lot of specialists in crisis communications who spend a lot of sort of academic time and effort into defining it. We're going to take a much simpler approach, really. So we thought these 2 quotes helped illustrate exactly what we meant by a crisis, the impact, the challenges, and then the second quote looking at basically touching on basically good planning and time and effort in advance of, God forbid, a crisis actually kicks off. So the first quote is from the British Standards Institute for Crisis Management. I think sort of encapsulates the exact challenges for an organisation and the impact in terms of a crisis. And then the second quote is from government communications, basically, that is sort of advocating good planning, preparation, and ensuring that one gets the right messages to the right stakeholders that we'll come on to in a minute. And I think it's fair to say, additionally, that there's some additional truisms around crisis. Firstly, there will be issues that organisations will be facing day to day, week to week, unfortunately, and that if those aren't resolved, then that's when a crisis could actually occur or develop. And also, lastly, to say on this point that the ultimate goal of crisis management is to ensure that basically the crisis doesn't happen at all, or if it does, that it's not as nearly as damaging as it could be. So I think, Matthew, on to the next slide. Thank you. Yeah, and just to put it into sort of, I suppose, human terms, really, in terms of what we're talking about and the impact of some of the sort of high-profile cases that we've had over the years, not just within health tech and healthcare, but also sort of on the domestic side. But these are some of the sort of high-profile cases in recent years. Theranos, which was a $9 billion company that was claiming to be able to revolutionize blood testing. Unfortunately, the Wall Street Journal then found out that the technology didn't work, and the company then was dissolved. We've had the cyber attack, the very high-profile cyber attack, for instance, last year involving Synovis, where patient appointments data impacted in terms of patient appointments being delayed severely. So a number of different high-profile cases within health tech and the NHS. Earlier this year, for instance, in Dumfries and Galloway, there was a substantial patient leak. Millions of patient data was unfortunately unrestricted. And then in terms of the context, in terms of sort of learnings over the years, one of the highest profile cases, obviously, which still gets mentioned, was over 30 years ago. Gerald Ratner, famously in front of the Institute of Directors, it was meant as a flippant comment, talked about his company's products as being crap. Unfortunately, that had a massive impact on the company. The company was eventually restructured, and Gerald Ratner lost his job at the head of the company a year later. He still asked questions about that, and I think one of the key learnings from that is he thought he was talking to a sympathetic audience, the Institute of Directors, but what he didn't realise at the time was that there was a Daily Mail journalist in the audience. What was meant as a flippant comment, unfortunately, when it's reported in black and white, is not so flippant and obviously extremely damaging. But day in, day out, we've seen even just this week the importance of these particular issues. I think just the last couple of days there's been another suggested data leak from a private health company. It's still being investigated at the moment, but again, a big issue to be handled and managed, and one that is regularly prominent for all sorts of different audiences, which we'll come on to in a minute. So, Matthew, back over to you. Thank you.
Thanks, John. And I think, as you say, these are just a few examples of headlines we touched on there. If you read HSJ, if you read the national, these are things that are in the headlines on a regular basis, and indeed even during this last week. But the areas that might impact you. Well, I think this comes down to partly your organisational specific nature of what you're doing. So this will vary from organisation to organisation, and I dare say you have a risk register that might set out the different areas of risk for your products, your services, your company, and the things that you need to plan for. But typically, in our sector, we see problems around data breaches, some of which we've just seen on the side there. We see headlines that relate to patient safety and harm issues, where hacked devices might come into play, for example. The impact of those things, of course, having a significant knock-on effect to potential care delays, to service outages. We see things like ransomware headlines, and WannaCry was perhaps the most famous one of those, but there's been others out there too, where the NHS has been in sharp focus on that, and of course healthcare technology companies sometimes link to that as well. Sometimes things might be beyond your control, things that you can't necessarily plan for. It might be external factors. We've had clients approach us for support, for example, where rumors and inappropriate things have been sparked on social media around a client's activity, which has been unfair. So it's perhaps, how do you respond to those sorts of things? It might be potentially your product's being misused, and you might need to be careful about how you think about responding to those things, as much as your product might not be at fault. And it might potentially be down to the way that it's being used. You don't want to necessarily put your customer in a bad light either. So there's sensitivities around how you can manage these things. And of course, it can be nothing to do with the technology whatsoever. It might be issues around individuals in the organization. And we have seen probably in the last 12 to 18 months headlines of quite senior individuals in health tech companies, not the ones you would hope to see and expect. So just a few things to point out. This is an area that inevitably is exposed to these crisis risks, and so that's why we're going to talk to you a little bit about how to respond to that. In doing so, really, there's different approaches that you can take. There's a few listed here of what people call the C's of planning, if you like, and the three that we really find are key in any sort of initial comms around a crisis is the concern, control, and commitment to show that you are concerned in your response. I think gone are the days are of when companies can simply say no comment in response to things that are happening. Of course, bearing that being said, it does need to be your crisis you're responding to in those situations, but it's about really showing that empathy, showing you understand the severity of the situation, that you are concerned about it, demonstrating in your communications that you are what control you've taken, what control you have over it so far. And it might be that it's not completely under control in those initial communications you put out there, but it's showing that you do what you do have under your control, and where you don't, what commitment that you're putting in place as an organization to resolve the issues going forward. I know we're just going to break that down in a little bit more detail, so I'll hand back to you, John, just to talk a little bit about the structure of how you arrive at those statements.
Thank you. Yes. So firstly, just to say that I think it's worth bearing in mind that there's a natural cycle. Whatever the crisis is, whatever the sector, basically, there is actually a cycle of preparing and managing a crisis. So initially, we'd see that there's a phase of mitigation where there's an ongoing preparation period, looking at and assessing at the reputational issues that the company might face. Then there's the sort of preparation, the prevention, the setting in place of the mechanics and the logistics, which we'll come to in a minute. Then if there is a crisis developing, there's a sort of a ramping up phase. It may not have actually hit the public domain at that stage, but it's widely accepted internally, at least, that things are beginning to get a bit hot. Then there's the managing process, when ideally the crisis management plan, that the communications, the supporting communications plan is put into place as well, and that's rolled out. And then obviously there's a recovery phase, which is where there's a mop up and a proper assessment of what went right, what went wrong. So to get into the nitty-gritty, basically, of what we'd see as a crisis communications plan and some of the sort of key elements of that. So basically, the plan should be not too long, nice and short, effectively. Something that's easy to follow and work to by someone who who's perhaps just joined the organisation, not full of jargon, for instance, and also something that's not being produced in a vacuum, so that every key function that will have a role to play in managing a crisis is actually represented within that plan and addressed. And then at the heart of that is also the crisis management team. And this will be separate from the leadership team of the organisation. And it's got its own mandate, and it's quite clearly its own responsibilities. And within the team, within the supporting plan, there's a clear process for escalation, and how particular issues will be communicated eventually, well, internally, but then eventually externally. And it's absolutely essential, we feel, that within that crisis management team, there is at least one person from the relevant comms or PR team or your external PR advisor. One key part of the process right at the outset is also assessing risk. And the likelihood is for any company that works, has requirements within environmental territory or social or governance requirements, there's likely to be some sort of existing risk register, as I think Matthew touched on earlier, and that we feel would be an essential sort of go-to point right at the outset of planning. So look at the register that already exists, and that will give some good pointers on where the likely Achilles heels are, where the reputational difficulties might crop up, what needs to be thought about in terms of the preparation and planning. In the health context, for instance, a cyber attack. Then there'll probably be slower burn issues that can be factored into the plan as well. Another key phase, obviously, is absolutely ensuring you're aware of who your key stakeholders are, because they're the ones who effectively give you sort of license to operate and have a reputation. And it'll be essential to have some sort of process of stakeholder mapping, therefore, to understand, to identify, understand, and prioritize your key stakeholders. And also, as part of that, a bit of micro really is absolutely ensuring that you've got key contact details. I mentioned I'd worked in the NHS in the past, and when we did get one awful incident over a weekend, the deputy CEO who's on call that weekend, he didn't have any of the out-of-hours numbers, mobile numbers for the comms team, for instance. So the comms team was rocking up to work on the Monday morning to find that the evening before the Sunday, there'd been this awful incident, and we were getting some of the national press outside a psychiatric unit, trying to get interviews with senior management. And the likelihood is that the range of stakeholders will include everything from staff, employees, could be the sales team if it's a sales-facing organisation, customers if you've got customers that you're liaising with and offering services and products to. If it's a health organisation, then there'll be patients as well and service users. Importantly, there will be the media to bear in mind. And if the company is a trading company with a share price, then there will be investors, shareholders, and industry analysts as well to factor in. So a whole deep dive really on who all your stakeholders are is absolutely essential. And then the other key part of it is also documenting the range of different channels and communications streams by which you potentially can communicate, not just internally, but obviously externally. And that will be a range of different channels. The likelihood is social media, obviously absolutely fundamental in this day and age. Company websites, the intranet to liaise with employees, the media in terms of getting news announcements and updates out to in the event of a crisis. And then perhaps slower burn if it's appropriate, your weekly internal newsletters. So the whole range gamut of communications channels needs to be documented and assessed. And then when unfortunately a crisis does occur, another essential part of the armory is ensuring that all the external channels, internal channels are being monitored And that might unfortunately mean 24/7, not just 9 to 5:30. And then also importantly, the messaging, planning around messaging to have perhaps some placeholders in place where key information can be just dropped in. So you've got the framework of some messaging in advance of a crisis blowing up. And related to that, a very short sign-off process. So you don't want to get obviously bogged down in administration and bureaucracy. And the thinking in terms of perhaps the template approach and preparing messages in advance is thinking about, what do you need to tell your stakeholders about what has happened? What do you need to tell them about how they have been affected or what's happening? And in a way, you need to guide them on what they need to think or what they need to do as a result, what the actions are as a result. And basically, that's in the context of the tone of your organization, really, in terms of how you want to be perceived, and also getting the tone so it's consistent with how you've previously communicated. Additionally, in messaging, again, if you've got a sales team, for instance, so that's relevant, then thinking about how we're going to arm your sales team in terms of what they need to do in terms of point of sales. If they're getting asked questions by their customers. And then also another important strut within messaging is who's going to be your spokesperson or spokespeople to front the external audiences, particularly the media, if it gets to that stage. Have they been media trained? Who also is going to be handling your social media and working out the rotas for that. And then we also feel it's absolutely imperative to have a process of crisis simulation, to test. If you've got a plan together, you've got a crisis management team as well, to put them through the paces, at least, perhaps twice a year, to see how the plans work in operation, whether they need to be amended, what works, what doesn't work. What the learnings are, obviously keeping mindful of best practice and also some of the incidents that are ongoing and regularly crop up and that may help inform your own planning and thinking. And then after either a simulation or, unfortunately, if there has been a crisis, then doing a proper analysis and wash up of the situation, not intended as a blame game, hopefully not, but again, what went well, what didn't work, what needs to be improved, how the relationships are with key stakeholders, what the feedback is from stakeholders, those sort of areas we feel it's essential to consider in the aftermath of a crisis or a simulation exercise. So I think over to you, Matthew. You're on mute, Matthew.
Thanks, John. So I think what's really just coming through from that is it's the planning stage is absolutely key. And if you haven't got a plan in place, don't feel too bad about it. I think there was some research from a US company a couple of years ago which suggested only about 50% of companies out there actually have crisis comms strategies in place. So it's not too late to start that thinking if you haven't done already. But you're not alone if you haven't done that. We see it as one of those strategies really that's important to have, in the event that you do need to use it. Hopefully you never do, but it's important that it's there. So a bit of a checklist really, just to make sure you're covering off the right things. Evaluating whether it's a crisis, how you're going to respond to it, that the approach might be determined by the nature of the crisis itself. Those stakeholders are absolutely key to establishing, and you can plan a lot of that out in advance in terms of who might be involved in various different crisis scenarios, who you might need to draw on, who you might need to engage, who you might need to communicate with. Sometimes that might be unexpected to a degree. We worked with a client a couple of years ago who sadly had quite a serious incident unfold where the misfiling of quite a substantial amount of patient data had led to delays in referral letters and things like that. And some of the stakeholders, they range from sort of Secretary of State level through to GPs on the ground who are facing questions from their patients. So it's worth bearing in mind that it might not always be that the stakeholders you imagine that you do need to brief, but you do need to be prepared to give that support to those individuals at the point where it's required. Think about that crisis management team. Who is it that needs to be involved in that in the organisation? Make sure you're convening that on a regular basis to make sure that it's still an effective strategy, that it responds to current and emerging threats, that the landscape hasn't changed, as John was saying. Just really think about the right channels, and the right channels might differ, both based on the scenario, based on the people you want to engage. It might be different social channels, as John said. It might be others, but make sure you're talking to people on the channels in which the conversations are going on, and also monitoring those channels for the emerging discussion to make sure that what you're putting out there is appropriate and responsive to concerns that are being raised. You might need to think about existing activity. It might be inappropriate to push out your press release on the latest new innovation that your company's come up with and how brilliant it is when you've just been in the one of the top nationals for something like sinister, or perceived to be sinister. So just think about the sensitivity around other aspects of communications as well. And then think about some of the external support that you can draw on. So, I mean, if you haven't done this before, it might sound daunting, but there is experience out there to help you. Organisations like ours, we do support our clients both in the preparation and sometimes when necessary in the execution side of these strategies. So, we're here to help if you need it. And it's also worth saying as well, just in terms of the stakeholder piece that John touched on there, and the spokesperson piece. Actually, the person who's dealing with the media, for example, they sometimes they're going to need a bit of a thick skin to deal with some of this stuff. If you are facing quite challenging questions from journalists, it can be quite a stressful situation. So don't overlook the fact that that support might be helpful in those scenarios. In terms of support, everything we've said to you today, just to give a caveat, is not legal advice. We're not giving you a strategy that's tailored to your organization's need on this particular webinar, and it wouldn't be possible or appropriate to do that. But do always bring in your legal team in this. We would strongly advise that you get things, both the strategy and your statements, were cleared by legal, just to make sure that you are not saying anything that might worsen the situation in some ways. And then finally, just think about, is this your crisis alone? And indeed, is this your crisis? It might be something that really actually is one of your customers' crisis, but you might want to play a supportive role in that and be there for your customer and help where you can. But don't be just bear in mind you might need to take a collaborative approach to this. And with that, as much as we've given you a framework today as to how you can start to plan and start to develop your strategy, it's worth bearing in mind there are others out there that might be used by your partners, by your customers. The government, for example, has a crisis communications approach called STOP, which stands for strategy, tactics, organisation, and people. And it also has a framework called the Krebs framework, which is really about communicating what's known, what isn't known yet, explaining what's being done about those things, telling the public what they should do. And indeed, with that, it's worth thinking about from a government point of view. Some of the crisis comms isn't necessarily even a reputational management thing. It could be around an emerging public health crisis, for example, or something like that. So that there's potentially a range of different scenarios where different strategies might be employed by different organisations. So just bear that in mind when putting these things into execution. I'm going to draw that to a close there in terms of our presentation, because we, as I said, mentioned that we would love this to be an engaging session. We'd love to answer any questions that you might have. So I'll hand back to John to pick up on that side of things, if that's okay, John.
Great stuff. Thank you very much, John and Matthew. Always enjoy these sessions, and I always learn something from them, even though I've got a few grey hairs. I've been around myself for a number of years now in this industry. I think some of those points they kind of seem obvious, don't they? Having people's phone numbers and knowing who to speak to. But until you kind of sweat this out and have a plan in place, you'd be amazed how you often fall short with these things. I think that things like that are just really worth thinking about. And actually, there's a temptation, isn't there, to think that this is just a kind of a comms person's job, but actually, this is everyone's job in an organization, isn't it? You know, the stakeholders, both internally and externally, are so broad. So I think that's an important thing to reflect on. And just from my own personal experience as well, no one likes the first point of contact to be when they're in a crisis. So I think having a network and having relationships on your day-to-day business is really important. So you've got that relationship already in place before you approach someone in a crisis situation. So those are just some immediate reflections from me. If anyone has any questions, please do pop them in the chat or raise your hand and we can come to them. But there were some other kind of thoughts I had, and then I don't, Matthew, you might want to take this one around. So this is obviously we're talking to a health tech audience here. Is what you described a playbook that is specific to our industry, or do you think that it could be applied to any sector as a whole in terms of the crisis comms plan?
Yes, I think, John, that the principles are probably largely the same across any sector, you might say, to some degree. The approaches you can take, the fundamentals of bringing everything together as we've described, and assessing your individual risks. But I think what's a little bit different when it comes to healthcare and health tech is I think I might reflect on a conference I was at some years ago, and there was somebody within quite senior within an NHS organisation that had got there that morning, and he gave the example of how he booked his train there and he screwed it up and it cost him 30 quid. And he said that's the worst that can happen. When you deploy technology in healthcare, the worst that can happen is significantly different. This is a case of life and death, of harm, of various things. So when things do go wrong, they can really go wrong. So I think that's probably one of the biggest differences to bear in mind. And the fact that, as when we touched on things like cybersecurity, data, things like that, you might say that healthcare is probably one of those industries that is at the forefront of targets for those sorts of things because of the nature of sensitive data that exists. So it's just worth bearing in mind that I think that's what makes the sector unique, is that as much as there's a huge amount to celebrate, and we're fortunate to work with so many organizations where we do get to promote the work they do, which is good. When things go wrong, they can really go wrong. So just to have that strategy in place is absolutely key to being able to deal with that.
Yeah, very sound advice. And I mean, and sometimes these things can be quite short, acute incidents that blow away, but other times these can be absolutely crippling for a business over many years and can linger around. So I think that proactivity and having that plan in place is absolutely critical. I mean, it's appreciating sensitivities. You may not want to name names here, but maybe he's cool. But I mean, are there any examples of well-handled crises in our sector that you can think of, or even more broadly, not necessarily our sector, and what made them a successful dealing of that crisis? Any thoughts that come to mind there?
I think it's sort of difficult to cite particular sort of standout examples. I mean, there are plenty, unfortunately, of cases where things haven't gone according to plan, as we know. And actually, I saw just recently, a company in the States seemed, on first reading a report of what they'd done in terms of managing a crisis, I think there was a data breach. They were sort of getting plaudits, it felt like, for regularly communicating externally. But then the sting in the tail was a criticism of the fact that actually their messages didn't say, the successive messages weren't varied enough, and they weren't actually giving any updates. So, the sort of objective view seemed to be they were rather shooting themselves in the foot. One example I did come across very recently, which actually impressed me personally, was a Scottish Health Board, actually, that, I mean, it wouldn't have been the only part of their sort of planning, I don't think. But what was I thought really neat was they'd put together over just one A4 slide, a landscape slide. It was obviously an internal, I mean, it was public domain, but it was mainly intended for internal consumption for staff, basically. And it basically set out all the things they should do in very simple language if there was an issue developing into a crisis or something that they didn't feel comfortable with. So something they might see on social media, for instance, something, it may be an incoming stray media call on something that was negative, that could escalate. And it very simply, over this one slide, as I was saying, put the stages of how they should escalate it and to whom, and the contact numbers. And I just thought that was a really good, effective way, very simple, but very, very straightforward. And one would assume they're regularly sending that round to teams, line managers, etc., to cascade, and then sort of ensuring, doing a sort of follow-up audit to ensure everyone's got it and they understand. Because, we probably all worked in organizations where there are, for instance, the media, there's going to be a stray media call if they get the wood for something. And, you want to make sure that it's being directed internally to the right people who are there to handle it. In that case, the press office, for instance.
Yeah. No, I think that's a great example. I mean, we're all guilty of working in silos, aren't we, in our own working lives, and particularly with a lot of remote working as well. Actually, just having a really clear playbook of who is owning what, and the escalation process is a great tip. So yeah, that's a great example. Thanks, John. And I guess relating to that, then, the kind of the inverse of this is there almost an opportunity sometimes in a crisis situation to perhaps strengthen your brand reputation, turn the negative into a positive rather than just mitigating the damage? As I'm thinking, for example, you could show your competency as an organization, that might reinsure an investor or your board members or your customers. Is there almost an opportunity sometimes?
I can comment on that one if that's okay, John. But I think there probably is the short answer. I mean, it's probably fair to say that one of the best things that you can do to almost mitigate the impact of these things before they happen, in addition to building your own strategy, is to make sure you're proactive with your good news, if you like. So get the good messages out there in the first instance, build that reputation, shout about your customer successes, shout about the things that you're doing in the market that are positive, and build the positive impact of what you're doing. And if you're well regarded in the sector, these things hopefully would land less badly than if you're perhaps you've got nothing out there that shows you're an organization that's helping healthcare to succeed. But in terms of the specifics around maybe convincing those investors, those customers, those external stakeholders, that you're able to respond to these things well, it comes back to having that strategy. If you are dealing with this, as you said, John, for the first time, you haven't got a strategy in place, if that's when the crisis lands, your appearance to your investors and your external stakeholders is not going to be great, because you're going to be scrabbling around trying to get things together, and that's not what you want to be doing at that point. You want to have a clear approach in place, ready to go, so that you can deal with this in a methodological way, and one that's proven to work, and proven to actually get the information to the people who need it at the right time. You've got to have that in place.
I think I just add actually on your question, John. I think what's important to bear in mind is that if you aren't perceived externally as handling an issue in the right way, then it's minus points, rather than if you do it correctly, it's plus points. I mean, there's this famous case, wasn't it, just a few weeks ago after Trump got into power, where there was that awful air disaster in the States, and there was a lot of commentators were making the comparison between how Trump handled it and how the CEO, I think it was, of the airlines actually held it, i.e. the CEO of the airline physically at the site of this disaster, and quite clearly giving proper tone and empathy, and then Trump, without getting into politics, not perceived as handling it particularly well, because he was coming out with all sorts of speculation way in advance of any sort of initial investigation. So that was a bang up to date example, really, of how just things like tone and empathy, and handling in the right manner, if they weren't handled in the right manner, obviously that's to the detriment of reputation.
Yeah, absolutely. And then so I guess it's always a tricky one, when sometimes we can track and measure sales, can't we? But some things are a little bit more nebulous, aren't they, when it comes to brand reputation? But is there a way to measure the success of a crisis response, after the fact?
That's good. It probably depends on a case by case basis, I guess, in terms of the crisis, in terms of the objectives, in terms of what you're trying to do to mitigate that, the effects of that crisis. And sometimes it can be quite bizarre, actually. We've come across scenarios where the actual good outcome was no coverage, and the chief executive sitting there thinking, okay, what have I spent my money on? I can't see any coverage here. And you're thinking, okay, well, you don't quite get it, do you? But it's a strange one, where you may find that it almost seems counterintuitive as to what you're trying to achieve for that. But I think, John, you probably got other insights into this as well from your experience. But
yeah, I mean, I guess it depends on the particular issue in the organization, doesn't it, in terms of the measure of success? It could be multifaceted. I mean, obviously, if a company's got a share price, for instance, I mean, it won't be the only measure, but one measure, I guess, is, well, what's happened to the share price, because that is basically a sentiment on the welfare of a company. And certainly some of back to sort of healthcare, health tech, and the NHS, certainly some of the reports I've read in the past, the key factor obviously is how much has this impacted on patient care. Say, if there has been a ransomware attack or a cyber attack, or data has been leaked, what and some of the examples we were flashing up earlier, there was obviously right at the heart of those fundamentally was impact on patient care, appointments cancelled, postponed, etc. But has it seriously impacted on patient care? So that would be, I think, within the healthcare sector, that would be a key measure.
Yeah, absolutely. I do have one final cheeky question that I thought of when you were doing your intro, John, but I'll just quickly pause to see if anyone on the line wanted to come in, ask a question either verbally or in the chat. But it was, you're talking about your background as a journalist, and I was thinking back wearing your old journalist hat, could you sniff out when an organization was in a bit of a crisis and they had not prepared, and was that almost an opportunity for a journalist? And so the flip side of that is, could you also tell a well-prepared organization from your vantage point at the time?
Yeah, I think top line, I mean, on the latter point, I think in terms of, obviously I had a media hat then, it's how speedy and responsive and giving the impression that they cared about your media inquiry. I think that was the and so conversely, if you didn't get that sort of response initially, then you thought, oh, actually, it's sort of could be a vindication of the fact you're onto a good story. If you could tell there was a bit of a flap going on, even when they eventually came back to you, they seemed calm. You thought you could read a fair bit into the way that you were being, I suppose, having leapt over the other side of the fence, being managed effectively.
Yeah, good stuff. Thank you, John. Well, I don't think we've got any questions that have come in, but I've personally found that a really, really fascinating presentation. Great insights from you guys. Great to have your professional insights there. We have recorded it, as you can see, so everyone will get a copy of that. We'll make that accessible, and I think you guys are happy to share those slides as well, and we'll make those downloadable from the portal as well. As I said, this is part of a series with Highland Marketing all around effective approaches to health tech marketing. So do let us know if you've got any ideas or thoughts of what you'd like to see in a future session as well. I think we're very open to how we take this series and the topics that matter to you as health tech professionals. So if there are any topics that you'd like to see addressed in a session like this in the future, do let us know, and we can set something up. Be very happy to do that. So it just leaves me to thank you both for as I said, was an excellent presentation, and the ongoing support and partnership of Highland Marketing. You've got the email address there in front of you, so we'll send all the contact details in the post communications to everyone that's registered. But if you've got any comments or thoughts for future sessions, do let us know. We'll be happy to explore those. Just leaves me to thank you both, gents, for another great session, and look forward to doing another one of these again in the future.
Thank you, John.
Pleasure.
And just to add, John, just one final thought. We appreciate this is a sensitive subject. It might not be something people on the call here are comfortable discussing publicly. If you would value a one-to-one conversation offline to explore any ways that we might help you to better prepare or even respond to crisis, then do reach out. We're happy to have those conversations.
Yeah, absolutely. And I think your colleagues are popping some links in the chat there as we speak, so that's perfect. Brilliant. Wishing everyone an excellent rest of the afternoon, and we're nearly at the weekend, aren't we? We're Thursday 2:00, so yeah, we're nearly there. So thank you again, guys, and wishing everyone a great rest of the day. Thank you.